This is Weekend Prime. Many thanks for staying with us. Now, after looking at how community health volunteers in Turkana County use color-coded beads to diagnose pneumonia in children before referring the sick children to the nearby health centers for specialized attention, today we focus on how the community health workers coordinate with nurses at various health facilities to enhance healthcare through successful referrals. Shadrach Miti with that story.
This is a child that this community health volunteer has been treating, and on this day, she is keen to know whether the mother followed the instructions on administering drugs. Although a community health worker can examine and diagnose malaria, diarrhea and pneumonia, she can only treat and administer drugs for malaria and diarrhea. The Kenya health policy does not allow them to treat pneumonia. Hence, should they discover a child with pneumonia, they are under instructions to refer the sick child to a nearby health facility. This child was diagnosed with pneumonia. The CHV had to refer him to Lobey Health Center for medication. Results have started to show that trained community health volunteers contribute to improved timely diagnosis, treatment and adherence to recommended therapy, thus improving the outcome of disease management, ultimately reducing death. Community health volunteers must accompany any sick child they are referring. And to enable proper action, the CHV must always carry with them the patient referral book, which must be handed over to the nurse in charge of the facility.
So they are acting as like in quote, village doctors, and they're helping a lot to improve access of households and communities to health care.
At Lobey Health Center, the nursing officer in charge receives the sick child, and based on the report from the CHV, he proceeds to conduct further tests. He then decides to admit the child.
Nimepata pneumonia bado iko, nimemweka kwa dawa ingine ile inafuata ile alikuwa anatumia. So dawa ya shindano. Ataendelea na hiyo dawa ya shindano kwa siku 5. Kisha sasa akipona sasa nimrudishie yule CHV. Kuna maagizo pia nitampatia yule CHV wakati sasa atamrudisha pale kwa kijiji.
Although counting of color-coded beads to tell symptoms of pneumonia in children is largely used by community health workers, professionally trained and qualified nurses admit the method is just as accurate as laboratory examinations. This approach has succeeded in Turkana largely due to the fact that the tools were developed jointly with the CHVs and pre-tested at community level before commissioning them. A set of county-based Turkana-speaking clinical staff are trained, with focus on knowledge transmission to an illiterate population using the pictorial ICCM job aids.
Kwa sasa ile uhusiano tuko na hao CHVs wamejaribu kunirahisishia kazi yangu, kwa sababu kuliko watoto wote kuja hapa kwa hospitali, kuna watoto wanatibua pale, wanapona, wanabaki huko nyumbani.
Health workers go and supervise them when they are doing their work, and that one has created confidence to the community members that these are also really doctors who can assist them.
They do not have any specialized training in medical or healthcare, not even basic education. But in a month, community health volunteers in Turkana County attend to at least 10 cases. Some they treat and others they refer to the nearest medical facility for specialized attention. Shadrach Miti, KTN News in Turkana County.